Hello, 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 ATHLers and all my friends on my Facebook page, on the page, and also on the group. I didn't have any plans on coming on today, but in my group for the past about 6 years now, 7 years, I've been coming on for every birthday and making every month and making sure that I celebrated everybody's birthday. So I'm on today to say happy November 2021. We are almost ready for Thanksgiving and also Christmas. Thanksgiving kind of just gets by. So again, let me just share this to my group too so they can go live at the same time. Excuse me, and please excuse the awkward few minutes I'm going to be doing this. Okay, hold on one second. I'm just going to have music playing this time around. So let me go there. Let me go in there. Okay, so I am here. And go in there. Eventually, I'm going to do this a little smoother. Of course, my okay, there we are. But my internet's acting up, so I'm gonna do this here, and just gonna have to go live later on the other flow because my thing is not behaving. Anyways, here we are. So happy birthday, happy birthday. I'm saying happy birthday to everybody celebrating their birthday in the month of November. Wish you all a beautiful month. There's so much going on in the month, but I'm just here today to talk about birthday. Happy birthday anniversary, happy birthday. Anybody who's celebrating something big in this month. I'm sure some people are graduating as well. Happy graduation, congratulations. First, I want to take the time to, for anybody who's going through any kind of downtime right now, our thoughts and prayers are with you. I have one special member who's always been like a biggest supporter of me. I don't know if you want me to call his name on here, so I'm just gonna say, you're in a hospital, and we're wishing you the best of luck. Wishing you speedy recovery, healthy recovery, and getting out, getting all the rehabilitation, and be back on, and so we can have fun and laugh and make fun and all that, because you're the ones who keep us sane around here. So we wishing you speedy recovery, and to everybody else who's going through any kind of medical issues right now, I say, hang in there and do everything your doctor's telling you to do so you can get well and be back with us soon as possible, and your family, most important, your family and friends. On November is also National Diabetes Awareness Month. Diabetes is such a major disease that I don't want to play any lip service by just talking about it. I did, if you look at my profile picture, you can see that I wrote a little bit about diabetes in there. So, but that's just a tip of the iceberg. It's not even a tip of the iceberg. It's like less than 0.000% of what goes on with diabetes, and it's a very, very it's like a life changing illness for you and your family members as well. So it's not something I want to play lip service to. So we do plan on bringing a show to you guys next Tuesday. Hopefully, I'm going to be doing that in collaboration again with another forum, so we can reach as many people as possible, and even those who will be doing another on their other forums as well. If you can reach more people, I reach this group of people, you reach that group of people, and all that. This is a disease, a global disease, so it's not something where if you just reach this person and then other people can reach it. So we want to reach as many people as possible. So we'll probably come by next Tuesday 7 o'clock to go ahead. Like I said before, I won't be here tomorrow at 7 o'clock for my regular show, so please, do that. Also, I just wanted to touch on the fact that with makeup, everybody's doing makeup now. We're all enjoying our makeup and getting our face beat, and also getting our, eyelashes and everything. I just want to say, please make sure that you go into reputable salons, or whoever is doing your makeup artist. Please make sure that they are licensed, or if somebody's helping you, please make sure that person knows what they're doing as well. Make sure when you're looking around in their studio, wherever they do their work, that everything there is almost sterile, like the brushes that they're going to be using, anything especially that has to do with your eyes, putting the makeup on, the glue and all that, making sure all that is nice and clean It can be completely sterile, but certain things they have to sterilize it if they're using it back and forth. So making sure, just ask them, how often do you wash your brushes between clients? How often do you change the glue that you're using? And making sure they're following, doing all that, because I've seen a couple of people coming in with eye infections and all that, and they had issues with the eyelashes and all. So we've been seeing that a lot. So I've been speaking to other providers too, and they've been seeing that. So make sure that if you're gonna put it on yourself, making sure you keep it. If you start your eyes start getting red or start getting itchy, make sure you take it off and keep it off for a while. Making sure also that you makeup or your makeup, don't, if you're gonna buy expensive one, be ready, because you're supposed to be changing your makeup every 3 months anyways. So you're supposed to be throwing everything out and buying everything every 3 months, and people don't, you can't afford to do that. So 3 to 6 months, making sure you wash, but you wash your brush as frequently as possible in nice warm water. Wash it out. Your eyelashes, they tell you, follow the manufacturer's instructions, but if you see that it's a little frayed and you don't need to wear it again, there's so many cheap ones out there that you can just use again, so you don't have to keep using the same one, especially if you had any kind of, your eyes were itching or you had any kind of eye infection. Your eyelashes, just get rid of it. Whatever you're wearing before, just get rid of it. I don't care how expensive it is, just get rid of it. Let your eyes breathe for a couple of days before putting it back in. Make sure, of course, you want to make sure you talk to your doctor, and if your eyes are red and draining, even if it's like pink eye, you want to make sure you get rid of that. Go to your doctors, let them take a look at it, because any little thing, if you get an infection in your eye, your eyesight is the most important thing. Beauty is beauty. Everybody wants to be beautiful, and I have anything against it because I have my eyelashes on too. But I want to make sure you're washing your hands before and after. Keep your hands away from your eyes. Keep your makeup brushes clean. Keep your way you do your surface, you do it clean. Making sure when you go into a makeup artist, also, like I said, most of them, they, if they're licensed, or they if they respect their work and all that, so they make sure that the studio is nice and clean and sterile, and they're changing and cleaning their brushes in between patients clients. Okay, so I just wanted to give that little tidbit there, because I've seen that recently. So most important thing is the eyesight. You don't want to lose your eyesight, so we want to make sure that you keep yourself healthy and keep yourself safe. And also, if you're doing it with other people as well, do not be sharing makeup. Do not share makeup. Do not share eyeliner, especially. Do not share anything that comes with the eyes. And even if you're sharing something, cream or blushes, everything that go in your face, you don't know. So you want to make sure that you're not sharing that. I know it's kind of tempting sometimes when you go to a relative's house and things, but you don't want to do that, because nothing may be going on with them, but whatever they have, it could be spread onto you. So you want to make sure you don't do that. Okay. It's just for your own safety. And like I said, wash your hands before. Make sure you're keeping your makeup and everything in a clean place at all times. And nobody else is playing with it or using it for anything else. So just a little tidbit there. And like I said, we'll be back in November, hopefully next Tuesday, to bring our show on diabetes. Try as much as possible to get almost everything in it, but try to make it too long to where it's going to be too overwhelming. So again, thank you all. For those of you who are liked this page so far, please can you make sure, can you just hit follow too, so you can come on when you can get the notifications and come on or watch during the time or after. And for those who will be watching later, I say thank you. I know everybody's busy and it's not always possible to have people coming on, and there's some people who have like a lot of, in our Liberian people, it's mostly politics or something salacious that would keep them on. So but in the meantime, I'm just owning my little corner, and I am here, and I'm not only Liberian people. This forum is for. It's also for I'm trying to reach just about everybody out there, because my patients are everybody out there. So stay safe. Enjoy November. I will be back next week, and good luck. Stay safe. COVID's still out there, so try to be, safe as possible. Speak to your doctor about whether you need to get a COVID vaccine and your flu vaccine. If you take any medications, take your medications as prescribed. Do not stop, change, skip dose, or allow your medications to run out without contacting your provider at least 2 weeks before. Make sure if your medication is running out 2 weeks before and you don't have automatic renewals, or if your doctor says you need to come back to the office first before they can renew certain medications, please make sure you follow up. Okay. And I will go into more detail later on. I plan on bringing like some good shows this month. Okay. And more interesting thing that people want to see too. So but for all of you out there, for all the other providers out there, healthcare professionals and all that too, we're all in this together and we want to keep our community safe. Okay, so thank you and happy November again. Happy November. I will see you guys. I'll probably come on Friday, but the show about diabetes will be on next Tuesday. Okay, thank you and good night, good evening, and those of you who are other places where you're already sleeping and waking up, good morning to you. Okay, thank you. Have a good night. Bye.